What advice would you have for kind of other healthcare leaders as it relates to kind of navigating a business within some of those regulatory limitations, so to speak?
Well, it's not easy. So having a background in revenue cycle, I understand payment very well. I think moving into air methods has been really challenging. So we pick up anybody and everybody who needs care. So 70% of the transports that we complete are either Medicaid or Medicare, and they are reimbursed significantly less than even the cost of the transport. So we lose money on those. And I think it's the management of that with your commercial payers, is complex. And I think that's pretty similar, to what else, is happening in healthcare as well. So how do you deal with that? I mean, we're really focused on, first of all, being 100% in network and making sure that we can negotiate fair rates that make sure this service continues for all those people that are out in those rural areas. And that's been a really huge focus for us as a company. And as we look, we were big supporters of the No Surprises Act. We think that patients shouldn't be in the middle of payment. We are concerned about, what we see in the first draft of the proposed rule. We all know those change, so I'm hopeful. But it doesn't consider the different types of providers. So, hospital-based providers versus private providers, geographies. And so we're working to get some of that in because it's so essential that the payment stays kind of as it is today. Because if it changes substantially, what will happen is you won't be able to, have those bases in those rural areas. And so it's always an ongoing challenge. So the first piece of advice, I suppose, is you really have to be on top of it, and you have to understand it as the CEO. You really need to understand where your money comes from and what's important so that you can navigate it appropriately. And then, what we're doing is kind of, brings that whole Six Sigma playbook back into play. And I know that, we see this in healthcare with high reliability organizations, but efficiency has to be what we think about. And how do you get it to be efficient in this world? Well, a lot of it is through automation, right? It's digitization. It's how can you make information more available? How can you reduce errors and repetitiveness? So we're really focused on that, both internally and externally. We've just purchased a software company. It's called Motion, and Motion's all about patient movement, and it's a place you can't see today. So if you think about healthcare, you have the hospitals, you have ambulatory surgical centers, physicians' offices. We have really great electronic health records in all of those. The part we currently can't see is how the patient moves from one place to the other and why and who sent them there.